Good afternoon, everybody. Thank you for being here. Happy St. Patrick's Day to everybody. Normally, we're having a parade right about now, but I guess it's just as well because it's raining out there and we might not have been able to parade anyway. So today we're going to talk about COVID numbers, of course. We're going to talk about vaccinations, and we're going to take your questions. So let me begin by talking about the COVID numbers here. The numbers are creeping up a little. And yesterday, the city of St. Louis reported 35 cases. We are now averaging 30 new cases a day. That's 10 cases per 100,000. Still best numbers of any county in the region. But nevertheless, we were down earlier, a couple of weeks ago, we were down at 20 cases per day. So as a 7-day average. So now we're averaging 30. So that's concerning, even though the numbers are still much better than they were quite a while ago. Hospitalization numbers today, and hospital numbers lag 2 days behind. So 263 people in the hospital. Of those people, 74 in the ICU, 47 are on ventilators. And so there's still some pretty sick people in our hospital. And we are now averaging about 36 people a day being admitted to the hospital. So again, numbers are creeping up a little bit, plateauing. We had for a while there a really pretty steep decline in the numbers, but that has leveled off. So if I can just reiterate to everyone, please wear your mask, follow, do social distancing, get your vaccination, and when you have the opportunity to do that, because we sure don't want to see these numbers going back up. So with regard to vaccinations, I thought you might find this interesting. There have now been 61,570 shots given to people in the city of St. Louis. Now that's 39,500 first shots, so that's how many people, almost 40,000. And that's up significantly even from just a week ago. And of those 39,500 people who have gotten the first dose, 22,000 of them, so a little over half, have also gotten their second dose. I know here in the city of St. Louis, we've done now 14 mass vaccination events. And starting next weekend, we'll be doing second shots on the people we did 4 weeks ago, and the weekend after that will be second shots. So that's at least part of the folks that have gotten a first shot and not the second shot. Two events to talk with you about in terms of vaccinations. One, this weekend, this Saturday and Sunday, the City of St. Louis Health Department will be doing the 15th and 16th mass vaccination events at America Center, at the Convention Center downtown. Now, this is invitation only. We're working off of our list, the people that are registered, and you will, if you haven't already, I know these invites are going out this afternoon. Those of you who are getting an invitation because you're on our list and because you're eligible, you'll get the invitation sometime today. Sign up if you want an appointment for either Saturday or Sunday. In one day, we can do, usually we do between about 1,500 and 2,000 vaccinations. And honestly, it just depends on how many vaccinators we have. We have over 15 each day for this weekend. And it depends on how quickly the line can move. So the America Center is a location that we have not used before. We will all be able to line up inside at the America Center, which is good because some rain is still predicted. And so if you get an invitation, please sign up for an appointment quickly, show up for your appointment, and also do not pass your appointment or your link along, because When you do that and the person isn't on the list as having received an invitation, what ends up happening is they end up waiting in line, they get up and then to the front of the line finally, and then they realize they're not on the list because it's not the invitation that they received. So, and that's really not a good situation when that happens. So don't pass your invitation along. Don't send it out to your whole, book club or your whole congregation. These invitations are meant for the individuals who signed up on the list. So hopefully this weekend we'll do between 3,000 and 4,000 people. This will be the Moderna vaccine, so it's a 2-shot vaccine. We'll do it in the convention center on Saturday and Sunday. Then, and this was announced last night by the governor's office yesterday afternoon, the state, along with the National Guard and our health department, will be doing a 2-day event next Thursday and Friday. So that's Thursday, March 25th, Friday, March 26th. That event will be at the Forest Park Community College there on Oakland. It'll be from 8 in the morning till 6 in the evening. You also will have to have an invitation. You can sign up for appointments for that. The state has not made those appointments available yet. We just checked right before we came on the air here, but I'm sure they will in the next few days. So you can keep checking back on the state's website in order to get an appointment for next Thursday and Friday, March 25th and 26th. This weekend, just to try to be clear here, on Saturday and Sunday, it's at the America Center. It's by invitation only, and we're working off our list of the people who have signed up and said they want to get the vaccine. That's good news. When you think about that, over the next 2 weeks here, we'll probably get vaccinated close to 10,000 people, give or take, of city residents just between the event this weekend and the event next week on Thursday and Friday. So that's good news. And we're getting more and more vaccine, and the state is getting more and more vaccine. The state's been receiving about 120,000 doses a week. But I heard yesterday, I heard them say that by the 1st of May, which admittedly is, 6 weeks away, they might be getting as much as 500,000 doses a week. So the vaccine is coming. Now the challenge, quite honestly, is finding vaccinators. So if there are any, retired or available nurses or doctors out there who want to give vaccinations, we have a volunteer pool of people who do that. So, and everybody across the state, frankly, everybody across the United States needs vaccinators right now. We are so appreciative of the St. Louis University Nursing School, Washington University. We've partnered with a number of universities who have nursing programs. Maryville University, and those folks have been vaccinating people for us so far as on our 14 events, along with our EMS, EMT folks who work for our fire department. They're very good vaccinators. All of these folks are very good vaccinators. But we know that when you volunteered for many events, some of your volunteers end up wearing out a little bit, or they have other things to do. So everybody needs vaccinators. We were on the pandemic task force call yesterday afternoon, and every county who's on that call can use vaccinators. So if you have that skill and are available, that would be great. Let's see. I think that's it. That's the COVID. That's vaccinations. That's happy St. Patrick's Day. Let's take your questions.
Couple of questions. First, are COVID numbers being impacted at all by the state now including antigen test results?
I don't think so. I mean, the COVID numbers, we get our number of positive cases, and we were, getting those cases all along. In addition, of course, the number of people that are admitted to the hospital, that's a hard number, not influenced by any of the other testing data, number of people in the hospital. So I don't think it is influencing the new cases.
So we have many people submit questions or comments about the number of St. Louisans who are continuing to drive many hours away outside the city to get vaccinated. When do we expect that to improve? And is it happening because people in other parts of the state are choosing not to get vaccinated?
In part, that's probably part of the answer. I think this is a little bit complex. You have a number of people who are very anxious to get the vaccine. They want to get it, and they want to get it right now. That's great. They are willing and able, and both of those things are important, to drive a couple of hours to get it. And some of the outlying locations do not have as high a demand. One, they don't have as much population, but two, they may just not have as much uptake in the vaccination. So there's nothing wrong with, if you want to, with going to another location to get the vaccine. Of course, if you can get it here, it's maybe more convenient for you, and that's good too. However you're able to access the vaccine is good.
We got a couple of questions. One's from Rebecca about who's currently qualified to be vaccinated, and is that the same people who the city and the state will be calling upon for the mega vaccination event?
Yes, so as you might know, Rebecca, on Monday, 2 days ago, the state said that Phase 1B Tier 3 people are now able to be vaccinated. And the Tier 3, I don't have the list in front of me, but it's teachers, it's child care workers, it's government employees. Somebody can tell me a couple.
Food, agriculture.
Food, that's right. People who work in
wastewater, energy.
grocery stores, energy, water, all those are now available. All the people in that category, Tier 3, are now eligible to be vaccinated. The city is still focusing on getting people over 65 and people with underlying health conditions vaccinated. One of the things that we do, and we're doing it again for our event this weekend, is of course we work off of our eligible list, but we also work with senior buildings, folks who live in senior centers or affiliated with senior centers. We also work with them to bring their folks to the events as well, because they don't, many of them do not have access to email or smartphones, and they usually often don't have transportation, so we provide the transportation. So we still are focusing on older people and on people with underlying health conditions, but teachers, childcare workers, food, people who work in the food industry, they are also eligible now to sign up for an appointment.
We got a question from Emmy who asks about how many more people need to get vaccinated for capacity restrictions in the city to be eased even further.
A lot. I can't tell you the number, but it won't just be about the city, it'll be about the region. We are at 50% capacity for restaurants. In the city of St. Louis, we're also at 50% capacity for event spaces. And any large venue has to submit a plan to the health department for how they're going to manage social distancing, mask wearing, ingress, egress, all of those things. So all of the big venues have their own special plans that they've developed with the health department. Right now, none of those venues are over 50% because it's, in most cases, you can't meet that 6-foot social distancing if you're over 50%. Now that may all change. This is changing pretty rapidly. If you think about it, here we are on March the 17th. It was right about 60 days ago. I'm trying to remember the date of our first vaccination event, but probably right around 2 months ago that we had the first vaccination event, and the vaccine was so sparse at that time. But now we're getting more and more. So this is going to change a lot just in the next 30 to 45 days. The challenge now will shift from, it's been the scarcity of the vaccine, it's going to shift from that to the ability to get those shots in arms. that hasn't quite happened yet, but we're on the verge of having that occur. And that's why I talked a minute ago about vaccinators. So I think over the next 30 to 60 days, we're going to see a lot of change and a lot more people will be vaccinated. And if the numbers continue to go down, they're not going down right this minute, but if they go back down and continue to go down further, then we will be able to lift some of those restrictions on occupancy percentages and that sort of thing.
Emily's watching and asked about the future of the current eviction moratorium. Do you anticipate that getting extended into the spring?
Is it Emily?
Emily.
Emily, I think that's pretty likely. You know, we are continuing to work on rental assistance and utility assistance for folks. We have about 2,000 people on that waiting list right now, and that they're working through those folks. So I do expect that will likely be continued for a while. We know that there's a looming housing crisis, there's a looming eviction crisis, and just because there's a moratorium on evictions, doesn't mean that the person doesn't owe the rent. So these folks that are behind in their rent, people who have lost their jobs or had their hours reduced, their financial situation, ultimately they will have to pay something, or they will have to get rental assistance for a portion of that. And so that's weighing heavily, I know, on a lot of people. So yes, I expect the eviction moratorium will continue for a while.
So speaking of, I don't know if you just mentioned the American Rescue Plan, but we did get a question about that from Mark, who asks if funding for that will be going toward fixing streets, infrastructure, and all of the potholes.
Probably not so much, Mark, except to the extent that the American Rescue Plan will, the funds can be used to replace the revenue that the city has lost and it continues to lose as a result of COVID. So when that money comes in, which the first tranche of that money will come in May 11th, and when that comes in, then we will have the funding in our general revenue to do our filling potholes and that sort of thing. Our street department has already been out filling a lot of potholes. I know there's a street that I travel pretty regularly, which is Union, and they recently, Union had a lot of potholes on it, and they recently filled those, but it's a temporary fill, until some of these streets can be repaved. You can't pave until it's sort of consistently 75 degrees. You don't want to pave, I should say, until it's 75 degrees or so, because that hot asphalt, you don't want that cooling off. You want it to go down. They've explained this all to me and really stick. So permanent paving doesn't happen till a little bit later.
And
maybe a month.
Last new question I'm seeing comes from Jim, inquiring about the roads in our major parks and whether the city's going to allow them to continue to stay closed.
So Jim, I don't know if you're a fan of keeping some of them closed or opening them all up, but I will tell you that I know that most of the people who I speak with like to have some of those major roads closed to cars, so that walkers and bikers and people having a good time in the park can use those streets. I know that's the case in Forest Park. There are a few streets that are closed. There are a few streets closed in Carondelet Park. I hear from one or two people who want all the streets back open so the cars can run on them, but I hear from a lot more people, frankly, who enjoy the ability to walk socially distanced with their neighbors or their families in the parks. So
I think that's it for questions today, Mayor.
That's all the questions? Okay. Well, good. Reminders, of course, stick with the mask wearing and the social distancing. Our numbers are headed back up. That's really the last thing that we need. And then secondly, this weekend, several thousand of you will be getting an invitation to get a vaccine this weekend at the America Center on Saturday and or Sunday. Sign up for your appointment, keep your appointment, do not forward your invitation because it won't be good for the person that you forward it to. If you have not signed up, you can still sign up. That would not, it probably would not be for this weekend because we're working off the list that we already have, but you can still sign up. If you know someone who doesn't have a computer or is unable to sign up electronically, they can call our health department, 657-1499. And just remember that we are working with senior complexes, senior centers. We are working with some of our immigrant population, all the folks that we might be missed if they're not online. So that's this weekend. Next Thursday and Friday, the 25th and 26th, will be the state's mass vaccination event. That'll be at Forest Park Community College. Hopefully soon the state will give you the ability to sign up for that. That'll be the one-shot Johnson & Johnson vaccine. The state always uses J&J. This weekend, we will be using Moderna, and that is a 2-shot 4 weeks apart. So thank you all so much. Appreciate you tuning in today. Have a happy St. Patrick's Day.